morning. It is still morning. I am Alvin McMahon, Director of Greater Fall River Medical Reserve Corps. Welcome to our news media here today, our City Mayor, all of our special guests that will be introduced later, and most importantly, our staff and volunteers that have made the preparation of this clinic possible. This December 7th, 2011 public flu clinic at our Fall River, Massachusetts City Government Center is being conducted concurrently with an emergency dispensing site drill. The incident command system is also activated. The Medical Reserve Corps is a community-based group of volunteers, medical and non-medical backgrounds, who support the public health network in natural or man-made disasters and other health emergencies. Our Greater Fall River Medical Reserve Corps serves the city of Fall River, the towns of Somerset, Swansea, and Westport. We have more than 325 registered volunteers consisting of over 200 medical and 100 non-medical. You will see a number of those volunteers working here today, supporting our Fall River Public Health Department. I would like to recognize our MRC unit coordinators that provide the administration of our volunteers. We have Margaret Canula, Fall River Public Health Nurse, Denise Wright, Fall River Star Clinical Manager, Donna Querum, she might still be at the wellness desk, Fall River South Coast Hospitals Group Nurse Clinician and Cardiac Prevention, Karen Long, Fall River Public Schools Director of Nursing, Tamara Lamoth, Somerset Public Health Nurse, Linda Saravo, Swansea and Fall River Public Health Nurse, and Kathy Burns, Westport Public Health Nurse. I will now introduce Dr. Henry Valancourt, Fall River Director of Health and Human Services.
Good morning, everyone. On behalf of the City of Fall River Health Department, I would like to welcome everyone to today's clinic. As part of its planning for a public health emergency, the Massachusetts Department of Public Health, through its Emergency Preparedness Bureau, requires each participating community to undertake planning and preparedness exercises. Today's event incorporates both a flu shot clinic and a drill for the operation of an emergency dispensing site. In the case of a public health emergency, Fall River has plans for a number of sites where vaccinations or the dispensing of medications will take place. The goal would be, within hours of notification by the state, to very quickly set up operation of our sites. With the H1N1 pandemic, we were able to test the operations of 2 of our sites. Today, we are retesting the operation of this site and fine-tuning it. Drills such as today's, where the Department of Public Health will be evaluating our setup, help us to continue to be prepared by working not only with the state, but with our local partners, such as the Fall River Emergency Management Agency, the Greater Fall River MRC, with its unit managers from Somerset, Swansea, and Westport Health Departments, South Coast Hospital Groups, the Fall River School System, and STAR. These exercises help us to identify areas in our plans that need revision or modification. Because we've been able to bring all of our partners here today, in addition to the flu shots, we're also able to offer wellness screening. So once again, I welcome you all and thank you. And now I would like to introduce the Mayor of Fall River, Will Flanagan.
Thank you. Thank you, Dr. Valancourt, and it's an honor for me as the Mayor of Fall River to be able to host today's flu clinic here in our city. And I just want to take a moment also to recognize the Greater Fall River Medical Reserve Corps and all the volunteers who will make this possible. Together between Fall River, Somerset, Swansea, and Westport, the Greater Fall River Medical Reserve Corps serves more than 138,000 residents. And if you think about the scope of the services they provide, as the mayor of this city, it leaves me with great comfort and confidence that no matter what the emergency is, no matter what the disaster, whether it's natural or man-made, that we have the team in place to respond to it. Through your exercises, through your drills, through your clinics like the one here today, it gives our citizens comfort to know that there is a team in place that is ready to provide emergency medical services to them in any time of need. So I look forward to our city hosting today's clinic, and as the mayor of the city, it is important to me to know and to recognize all of the volunteers here. And if you look around, you have individuals, whether they be from government, from healthcare, from nonprofits, who have all come together to improve the quality of life for the people of our community, the greater Fall River area. So on behalf of the entire citizenry, I just want to say thank you and keep up the good work.
Thank you, Mayor. Now I'd like to introduce our Bristol County Medical Reserve Corps Coordinator, Dennis Swift.
Good morning. Welcome to Bristol County and Fall River. As of today, we have 767 MRC volunteers in Bristol County, with an overall population of 550,000 members in this community of Bristol County. I have the great pleasure as the coordinator of overseeing the training, recruitment, credentialing of all Bristol County MRC residents, volunteers, and the greatest thing about being able to do that is just working with them in general. Doing flu clinics, doing training, providing training, and getting to meet all the different aspects of what it means to be in the Medical Reserve Corps. Thank you for this opportunity for allowing me to speak to you all today. At this time, I'd like to introduce you to my boss from the State Department of Public Health Office, Mike Coughlin.
Thanks, Dennis. Good morning, everybody. I'm always happy to attend a morning meeting in my hometown. I have to commute to Boston. I was the health director in Fall River when we organized the Medical Reserve Corps about 5 years ago, and it's been gratifying to see this unit to grow and become such an active part of the community. It's been a very busy 6 months for Medical Reserve Corps units across the state. We have the Greater Fall River is one of 46 units. We have about 10,000 volunteers statewide. Over the last 6 months, Medical Reserve Corps members, including some from Fall River, have spent thousands of hours staffing shelters in response to the weather-related emergencies that we've had this year. The Western Massachusetts tornado, the tropical storm Irene that happened in the late summer, and then we got whacked with that Halloween weekend snowstorm that took us completely by surprise. And shelters were open a week or more in different parts of the state in the aftermath of all three of those events. And Medical Reserve Corps units were among the vanguard that kept those shelters open, providing a safe and secure place for people whose homes had been destroyed in the case of the tornado, or who had no power for many days in the aftermath of the two other storms. So it's, as other speakers have said, it's gratifying to know that we have people in place ready to respond. And I congratulate you on this event today, which is being filmed, as most of you know, for a production sponsored by the National MRC Office. I get to introduce one of my colleagues from the National Office, who I work very closely with, and we're very honored to have her and her boss, Captain Casado, the head of the national program, with us today. But I'm going to introduce Jennifer Frenette, who is the New England, the Region 1 coordinator for all of the Medical Reserve Corps units up here in the Northeast.
Thanks, Mike. And thanks for all of you for being here today. Thanks to you, Mr. Mayor, and city officials, and Alvin, as well as my colleagues from the state and regional level and the national level. My name is Jennifer Frenette, and I'm the regional coordinator for the 6 New England states of the Medical Reserve Corps. My job is to work with the 87 unit leaders to be successful in working with the volunteers to promote community health and safety. Fall River is blessed to have Alvin McMahon leading their MRC. He's always engaged. He's creative in his approach to his tasks, for sure. And I just want to say thank you to Alvin for always saying yes. And then he successfully follows through, which is why there's so many people here today. As I can't say anything more than my colleagues have said up to this point. The Medical Reserve Corps in New England has been exceptionally busy the past 6 months or so with all of the weather-related emergencies. And then on the side, they promote community public health through events like today's Flu Clinic. At this point, it's my pleasure to introduce the brains behind the brawn, the Director of the Division of the Civilian Medical Reserve Corps, Captain Robert Tasato.